Do that. Welcome everybody to our Real Mushrooms Practitioner Roundtable, and I'm very excited. Tonight we're honored to have Dr. Ryan Best, and Dr. Ryan Best is a naturopathic doctor, and Dr. Best, he's got a focus in integrative cancer treatments, and Dr. Best and I had the privilege, I should say, of going to school with Dr. Ryan, and we had a lot of interesting and fun times trying to get through medical school. And yeah, Ryan's a really smart, kind, caring guy. So I'm happy that he's here to share his knowledge and his open heart with you in tonight's roundtable. So in practice, Ryan actually has a focus in supporting those with a cancer diagnosis, and he does that with integrative therapies. So his aim here is to try to increase the quality of life, limit side effects, and help support survival outcomes with his patients. Dr. Best's skills and clinical experience have allowed him to witness transformational changes in those going through cancer treatments. So Dr. Best is a member of the Oncology Association of Naturopathic Physicians, and he's a graduate from the Boucher Institute of Naturopathic Medicine. He's also an experienced practitioner at Nirvana Health. This is an integrative naturopathic clinic located in Calgary, Alberta. And Dr. Best uses a comprehensive set of treatments, including IV therapies, advanced testing, mistletoe therapy, medicinal mushrooms, custom nutrition, and neurofeedback in his practice. Dr. Best is a naturopathic doctor who combines his knowledge of human physiology and biochemistry with a wide array of treatment protocols, mostly targeted towards individualized approach to therapy. Without further rambling, I really want to just open the floor to Dr. Ryan Best.
Thanks, Mason, for the really warm introduction, and hello, everybody. Today, obviously, we want to talk a little bit about, obviously, some of the focuses of the talks will be on medicinal mushroom extracts today, talking a little bit about how they can be utilized, what some of the current evidence is showing us as far as effects in human health, how it can be combined with various different types of conventional cancer treatments used as an alternative or integrative treatment. And then if anybody has any specific questions about medicinal mushroom extracts, especially around their use in integrative oncology or any other fields, feel free to shoot those over. I think there's a Q&A box, Mace, for this?
Yep, and there's already some that are in there, Ryan, and I don't know if you'll be able to see them because you came in late, but I'll kind of feed you the questions if that works for you.
Yeah, that sounds great. And then, so we'll talk, make sure to try and get through a bunch of those questions. Any other questions that anyone has about supportive integrative care around the oncology realm, I'd be happy to discuss some of those questions as well today. And then, yeah, Dr. Bresset, if you maybe just want to let us know how you like to start off today as far as what we want to start going through.
Well, why don't I just get right into some of the questions, and then maybe we'll kind of see where that goes and go from there?
That sounds great.
Okay. So the first one here, which I'll just start with, Dr. Ryan, is, so mostly we hear that, in terms of natural therapies, mushrooms are a big thing, they're a big trend, and cancer is obviously a big tagline sometimes that comes with that. But we've got some practitioners with varied backgrounds in here tonight. And one of them was just wondering, Dr. Kalsa was wondering, are there any contraindications or times when you don't really want to use mushrooms for sure?
Yeah, that's actually a really good question. Now again, medicinal mushroom extracts, that's a broad category of therapies. As most of you are aware, practitioners, we have several different types of medicinal mushrooms, including Coriolus or Turkey Tail, Reishi mushroom, Organoderma, chaga mushroom, shiitake and maitake extracts. And they have some similarities, but they also carry some very unique compounds in each one of those, which does kind of predispose them to different use cases. And we're going to talk about a few of those today, but that can also predispose them to different contraindications as well. A couple of things to be aware of, and this is something I've seen in the research as well as in my own clinical practice, is that some of the more common, when we're talking about side effects and contraindications, some of the more common ones that I've seen One thing to be aware of if you haven't used a lot, especially of high dose medicinal mushroom extracts, and this is typically, if we're talking about purified extracts like Namex extracts, you're looking at kind of getting into that 2 gram to 4 gram dosing. It's very common, up to 20-30% of patients are actually can experience some indigestion and loose bowel movements with that. That's the most common side effect that I see with these therapies in practice. Something good to warn your patients about. Now, again, if you're using low doses for preventative, immunosupportive effects, which there is some great research on several of those different medicinal compounds on, just supporting white blood cell counts, natural killer cell counts, T cell counts. When you're below that 1 gram, and especially when you're doing divided dosing, 250 or 500 milligrams once or twice a day, very rare to actually see that side effect. But as you start to build up into, and oncology often requires, guiding into a lot of what the research shows, you have to often get patients to that 2, 3, 4 gram mark. That is something to warn your patients about. It does tend to mitigate that side effect by taking it with food and also dividing the doses up as much as possible. That's, again, something you kind of have to play a double-edged sword there, because if you divide the dosing up too much, patient compliance becomes a big issue. When you start trying to get patients to take something 3 times, 4 times a day, very common to have them missing dosing, forgetting to take doses. I typically try to get my patients to do twice a day, morning and evening doses most often with the medicinal mushroom extracts, doing about 1 gram to 2 grams in each of those doses, depending on the clinical outcomes that we're looking for. So watch for indigestion, watch for loose bowel movements. That's especially important when you're making considerations when these patients are already on some type of therapy, including a lot of different chemotherapy agents and some targeted therapies that you can be using for cancer that can already predispose them to indigestion and diarrhea. Those are common side effects with a lot of conventional cancer treatments, so something to be aware of. That being said, another therapy that you can actually utilize, and I use this alongside chemotherapy, most chemotherapy agents, because the research is quite good, along with radiation therapy that's being done on the abdominal area as well. Very common with colorectal cancer, hepatocellular carcinoma, or liver cancer. Having localized radiation can cause quite a bit, and prostate cancer actually as well too, because of the area that's being irradiated. Very common to see a lot of radiation-induced diarrhea from that. Using L-glutamine powder, very, very straight up L-glutamine powder, 10 grams twice a day, is an extremely well-researched and extremely effective way to mitigate a lot of that diarrhea that can be induced by those conventional therapies. And using that alongside the medicinal mushroom extracts often will actually significantly decrease the risk of getting that indigestion and diarrhea, the stomach cramping that can come along with that. Specific contraindications, now kind of going further than that, not just side effects that can show up. Contraindications, I would say certain, and it's not an absolute contraindication, but something that you want to pay attention for is overtly uncontrolled autoimmune conditions. We see lots, again, in my practice, I see quite a lot of very severe ulcerative colitis and Crohn's disease, rheumatoid arthritis, psoriatic arthritis, as well as multiple sclerosis. Now, the reason I say relative contraindication and not absolute contraindication is it's not every patient that has these rheumatic or autoimmune conditions is going to have a significant flare-up with medicinal mushroom extracts. In fact, some of the medicinal mushroom extracts can be immunomodulatory and actually help the immune system slightly regulate some of its autoimmune inflammatory activity. But you do need to be cautious in those patients. You need to make sure that when you're using these therapies, let patients know that there is a risk with some of the therapies that we may be using that it could flare up symptoms. So making sure that we're tracking blood work and especially checking in with patients in the first week to 2 weeks of initiating any of those therapies, monitoring for symptoms and side effects, and make sure we're adjusting the protocols as needed. So the autoimmune inflammatory piece is probably the bigger area that I would say is kind of that relative contraindication for medicinal mushroom therapies.
Thanks, Ryan. Okay, so let's work with, this is more general, but please feel free to ask, or sorry, to answer as targeted as you want, Ryan. But how do you generally approach using mushrooms in conjunction with radiation, radiotherapies, and chemotherapies?
Yeah, it's a broad question, and I'll kind of walk you through what some of the clinical trials have shown. And if anybody's interested as well too, I'll make sure to share some of these clinical trials that I'm speaking of with Dr. Bressett as well, and we can have those circulated just if anybody would actually like those for their records and review. When we look at medicinal mushroom extracts, there's several that I consider kind of staples in my oncology practice. And I'm gonna speak about a couple specifically today, and I'll talk a little bit about what the research shows, why they can be useful, how they actually combine and integrate with a lot of conventional oncological and anti-cancer therapies, and then how we can also use them for quality of life support as well too. So for anybody who's treating a lot of cancer patients in their practice, what you'll be aware of is that, again, chemotherapy and radiation being two of the four main pillars of treatment that are typically done in oncology, they still make up 70-75% of most of the treatments that you're going to be seeing for the variety of solid tumor cancers that are most likely to come into your practice. So what are the most common side effects that we're going to run into in that with those conventional therapies? Some of the most common side effects that we're going to see, fatigue is probably number one that you're going to see with most chemotherapy and radiation support protocols. This is kind of a side note on quality of life. One interesting therapy that seems to actually have some benefits with that is actually using high doses of Ganoderma, reishi mushroom extract. There's been significant levels of randomized control trials, and I've seen this in practice, that using Ganoderma extract alongside, and it's been researched with well over 25 different conventional chemotherapy protocols, as well as localized what's called external beam radiation therapy. And this was applied in different areas of the body, thoracic, as well as head and neck radiation therapy. And it did show a reduction in fatigue scores when we used about 1 gram to 3 grams, depending on the trial, per day of Ganoderma extract alongside those conventional agents with no significant interactions. There was no reductions in the efficacy. And that's a big important question when you're working in oncology is, are these therapies going to interfere with the tumor reductions that we're trying to induce with these conventional therapies? So it's important to recognize that. All of the data so far has shown no negative interactions, no interference with the efficacy of these conventional therapies, chemo and radiation. What was interesting, so let's talk a little bit about Ganoderma, about reishi mushroom extract. The reishi data has been very, very positive and conclusive over the last 10 to 15 years that it's been running clinical trials. What it's shown is several different efficacies as far as treatment, useful treatment cases for the oncology setting. Number one was in almost all, so about 85% of the randomized control trials that have been done, using reishi mushroom extract in combination with various chemotherapy agents and radiation therapy, it showed an average of a 20 to 30% increased response rate to those different conventional agents. And by increased response rate, what that meant was, and I'll send these trials so you can actually take a look at the breakdown on that, increased response rate either meant significant increases in tumor burden reduction in comparison to using a placebo. Again, being a randomized control trial, placebo controlled, in comparison to placebo, 20 to 30% improved response rate with tumor burden reductions, or chances of getting what we call a complete response in oncology, which is elimination of tumor burden on scans and blood work as well too. So reishi seems to actually have immunomodulatory effects. That the research articles actually go into a little bit more of the detail on this, but they think because reishi mushroom seems to stimulate CD3, CD4, and CD8 counts, white blood cell counts, which are our T helper cells, cytotoxic T cells, which are directly stimulating anti-cancer activity in the body and causing tumor burden reduction. They think that actually by inducing that activity, it seems to increase the response rates to these various types of agents. Another interesting note, just looking at the mechanisms behind that, what most of us know who work in the with these conventional agents, one big problem we have, especially with chemotherapy, but to a milder effect, radiation therapy, these are very potent immunosuppressive agents. Most of these agents really do a lot of damage to white blood cells in general. They're bone marrow suppressive. They will knock down red blood cell and white blood cell counts, sometimes to the point where you can end up with severe neutropenia, where you basically have such low neutrophil counts that these patients are at severe risks of infection. And we often actually have to discontinue chemotherapy because of that, or at least give them a treatment pause. That's problematic for two reasons. Number one is knocking neutrophil counts down is dangerous for a patient. We don't want to see that happening for them, puts them at very serious risk for complications. Number two is that we know that knocking down the immune system is our hallmark defense network that's actually trying to go out and kill these cancer cells. We need our immune system functioning to a high degree to not only help us get further tumor burden reductions, but when we get rid of the cancer, we also need that immune system functioning to a high degree to prevent a recurrence. Because everyone who's had a solid tumor cancer, once you go into remission, you are at a significantly higher risk for a development of a secondary cancer after that. And those rates can be anywhere from 2 to 10 times higher, depending on the cancer and the other comorbid conditions that are present in that patient. So reishi can be a mainstay because it's such a good immunostimulatory molecule. It can really help buffer that immune system compromise that can happen with chemotherapy agents. I've seen that tracking blood work with patients as they go through chemotherapy. We start to initiate the reishi mushroom extract for them, and those white blood cell decreases that were happening slowly and steadily over those several rounds of chemotherapy or radiation, we start to see it stagnate. And a lot of times we can actually stabilize it as well too. So keeping those white blood cells as active as possible. Most patients are still going to see some white blood cell drops. We'll actually usually combine this with high doses of astragalus extract as well, which is another herbal medication. It's got excellent research on it for supporting white blood cell function, and very good oncology research out of several major oncology centers in China, in Taiwan, in Japan, South Korea, as well as in North America for stabilizing that white blood cell activity. But reishi seems to go that step further by not only just protecting white blood cell counts, seems to have moderate increases in quality of life, specifically fatigue for a lot of patients, and seems to improve the response rates with every chemotherapy agent that it's been tested with so far. So very big mainstay in my practice. Again, when we're talking about dosage guidelines, most patients we're going to want, if you look at most of the randomized control trials that were done, it's significantly higher doses than we tend to use for these immune support protocols that we'll often use for non-oncology patients, working up between that 2 gram to 4 gram daily dosing. So you're going to want to start them off. I'll start most of my patients off at 1,000 milligrams with breakfast, 1,000 milligrams with dinner. Track them over a week, see how their GI function is going with that, warn them that they can have that indigestion, start them on that glutamine powder at the same time, make sure everything's going well. And if they're tolerating that well, I'll often have them actually switch over to a powder instead of a capsule. Namex actually has powdered extracts for this that I use quite frequently in practice, and you can get significantly higher doses without having to take as many capsules for a lot of patients that just don't, just kind of want to mitigate their pill load. But I'll try to work them up to that 2,000 milligrams twice a day at that point. That's consistent with some of the better research that we have.
That's great. I think that's a good start for people to understand the rationale there and how you use those in practice, Dr. Best. Dr. Kelsa, I hope that was enough to get you started there with a couple of your questions. I'm just going to ask to see if that was kind of what you were looking for. And if you have anything you wanted to ask to Dr. Best, you can unmute yourself right now, or we can move on to the next question, but I'll give you that opportunity.
I wanted to ask you the question, Dr. Best. Here I am.
Hi.
When you're talking about grams, are you talking about grams of the mushroom powder that, let's say, might be 25% beta glucans per the Nanex extract? Are you talking about, 2 grams of the hot water extract? What exactly is the material that you're dosing at that weight?
Yeah, and that's a really important question, because if you look at a lot of the different medicinal mushroom extracts that are on the market, they can be very different depending on, number one, how are they extracted? Number two, are they coming from mycelium base versus whole fruiting body? Number three is, do they standardize them for some of the actual medicinal compounds, beta-D-glucans being part of that, some of the polysaccharide molecules that we know are crucial to some of the response mechanisms, especially, and we'll talk a little bit about turkey tail, Coriolis. That's actually very crucial when you're talking about standardized extracts for that. So for myself, I'll just speak a little bit about what I typically use in my practice. practice. I use Namex powders exclusively in my practice because I think they do by far and large the biggest quality analysis that they're actually trying to guarantee with these products. I've actually read some really terrifying trials over the last 4 or 5 years that actually did some sampling of about 30 to 40 different medicinal mushroom extracts that were on the market. They found that 30% of the actual extracts on the market barely had any actual medicinal mushroom polysaccharides in them. That was 30% of the products that are on the market. That is patients completely wasting their money and not getting efficacy out of it. The secondary thing, and Namex does this quite well, is you can actually contact them to get breakdowns of the medicinal components and the standardization process that they actually guarantee minimum amounts of these required polysaccharides and molecules that should be present. So that's a really important thing. And I always tell practitioners, when you're trying to decide how you're going to be used this, again, Namex is one of the better companies in my mind. There's several companies that do standardization and can give you these metrics, but Namex, I think, goes a step and above for guaranteeing quality, guaranteeing no impurities. They'll provide you the lab analysis data, actually look at it for yourself, and they get it done third party, which is important to reduce bias. Again, companies that are running their own quality analysis trials, there is inherent bias in that, and that's important to pay attention to. But Namex guarantees those minimum levels of the really important polysaccharides that we need to see in reishi and Ganoderma, as well as Coriolis. But when you're trying to decide, when you're using, let's say just for oncology practice, it's important to actually go to the clinical trials and look and say, what were the doses that they were using in the clinical trials? Were they using extracts that actually had guaranteed levels, or were they using specific actual extracts out of those mushrooms? Were they using whole fruit extract versus were they actually using a specific molecule out of that mushroom that showed the effects? Because again, the better that we can take our therapies to match them to the exact type, the exact dosing strategy that was used in the clinical trials, the more confident we can all feel that we're going to be able to reproduce those effects in our patient population as well. So again, for Ganoderma specifically and Coriolis, I think it's important to make sure we're getting that quality analysis trials. Namex, I think, carries, when you look at a lot of the comparison, and I've compared this with NFH, I've compared this with a couple of other professional brands out there, Namex seems to carry the highest levels of these polysaccharides in their extracts as well, which is, again, another reason why I tend to use them exclusively in my practice.
Aren't you concerned
Thanks.
about giving glutamine to cancer patients?
I'm assuming you're getting to some of the trials that we're talking a little bit about glutamine potentially being stimulating as far as solid tumors.
Well, not just stimulating, but as a secondary fuel source for cancer.
Yeah, and it's a good question. So what he's speaking about there is that there have been a couple smaller trials, and we've got metabolic studies. So these are in vitro studies in the lab looking at solid tumors, suggestive that certain types of solid tumor cancers, prostate cancer seems to be one of the bigger ones for this, but tumors are smart and they can learn to actually avoid having to use glucose as a primary fuel source. There is several in vitro and some animal studies suggestive that certain solid tumors can actually switch their metabolism over to start to metabolize glutamine, an amino acid, and some of them can actually metabolize methionine as well too. Prostate cancer's got its own kind of unique quirks where it actually seems to be able to use choline and some fatty acids, which is important when you're making dietary considerations. Prostate cancer actually very rarely responds to low sugar diets. We know that keeping processed sugar is important for keeping it low for, I should say, for a lot of our cancer patients is still important for metabolics, for inflammatory regulation. But again, ketogenic diets, I don't think are very helpful, and in fact may actually be harmful in prostate cancer. That's just a side note to be aware of. And you can look into some of those metabolic studies in small human trials. But with glutamine specifically, what was interesting was, so if you look at those in vitro studies, the lab studies, yes, there's mechanistic data to suggest growth. Number two is that if you look at some of the animal studies, yes, when you fed very high levels of glutamine, this is talking about supraphysiologic levels of glutamine, reaching what would be the equivalent of basically 50 to 200 grams of glutamine powder per day being taken by a human, it does seem to have a mild stimulatory effect. and be able to be utilized by the tumors. But the problems with that were two things. Number one was those levels are very hard to reproduce in patients. It's very, and I would argue very completely unreasonable to actually try to work a patient up to 50 to 150 grams of glutamine. You will not see that get any more benefits as far as the digestive protective effects and metabolic saving effects as far as protecting lean muscle mass as you would with much lower doses, 5 to 10 grams twice a day. The second piece, what's really important when you're looking at tumor outcomes is what did the data, the actual human trial show? And what we've seen so far, and again, I'll share this data with Dr. Bressett for you guys to be able to review this, take a look through it in more detail. But when you look at most of the clinical trials, these were trials where we weren't using glutamine by itself. These were trials where we're using glutamine with very strong anti-cancer therapies. We're using it alongside multiple rounds of different chemotherapies, radiation therapies, targeted therapies, and usually integrative IV therapies. These therapies are doing so much damage to the tumors that adding in small amounts of glutamine does not seem to make any difference to the tumor burden, any type of tumor burden reductions that we're seeing, right? If you were just using high levels of glutamine away from these very strong oncological therapies, I think there would be more grounds to be concerned about potentially stimulating tumor growth. But because we're using it for basically side effect management and quality of life management alongside these heavy hitter therapies that are doing serious damage to the tumors, I've never seen it actually be a problem in practice, and the human trials just really haven't parsed that out. All the data really showed no reductions as far as efficacy of those conventional and integrative therapies. Hopefully that answers your question there. But that's actually a very common area of debate. I've had that question come up quite a bit, and I have some colleagues that actually won't use glutamine in their practice because of those concerns. But my opinion, based on the data that I've seen and what I've seen in patients, glutamine at low doses, I don't think it's stimulating any tumor growth. It's not passing that threshold of being able to be metabolically useful for a cancer. Glutamine actually gets wiped out by chemotherapy agents because glutamine is actually very strongly required for enterocyte repair in the GI tract. And the GI tract takes a beating when people are going through a lot of different chemotherapy and radiation therapies. So again, I think the benefits far outweigh any small risks that we might be taking for using glutamine short term. Once patients have finished chemotherapy and radiation, we've healed up from the damage there, and that's typically 4 to 6 weeks post chemotherapy, I discontinue glutamine. I don't actually keep using it. Again, if we don't need to use it, and there's even a mild chance that we could be helping any tumors be able to respond, we want to cut that out as soon as it's unnecessary.
Thanks, Dr. Best. I just want to get Ralph's next question in here, if that seems like a good place to kind of transition. But is there evidence that medicinal mushrooms can raise lymphocyte counts in patients that are low because of chemo?
Yes, absolutely. That's a good area for a use case for medicinal mushroom extracts. Two of the mushroom extracts that have the best research on them so far as larger clinical trials are Ganoderma, reishi, and Coriolis, turkey tail. Both of those medicinal mushroom extracts, when used in the proper doses, have shown pretty significant, basically immunostabilization effects in several different chemotherapy and radiation therapy trials. Again, chemo being the major one for having major immunodepletion effects. We don't often see, so again, this is something to be aware of when you're watching these lab counts for patients as they're going through treatment. One of the benefits to actually, when patients are going through chemotherapy and radiation, especially chemotherapy or targeted therapies, they're going to be having regular blood work done before every single new round of therapy, which allows us to track these changes on a very, usually often on a bi-weekly basis for a lot of these patients. But what I've seen very strongly in clinical practice, and the research shows this too, is you're still going to see with these supportive therapies, reishi and turkey tail, and often again, consider astragalus in this case as well too. But using those therapies, what we'll often see is you're still going to see some drops in the white blood cell counts, in lymphocyte counts, and as well as in neutrophil counts. But the drops, the severity of those drops can be drastically different if you're using these supportive care agents versus not. I've also seen a lot of patients who didn't see me before they started any of these therapies, but rather started suffering through these different types of conventional therapies and decided to come into my practice after having 2, 3, 4, 5, or 6 rounds of these therapies. these patients, a lot of them were at immunodepletion levels, really, really low white blood cell counts. And when I started to initiate these therapies, reishi, turkey tail, as well as astragalus, we started to see those counts rise. Nothing changed with their chemotherapy protocols. They were still getting their regular regimens of chemotherapy. But what changed was we were adding in these supportive therapies and we started to see those levels rise. So that's a very good immunotherapy support that we can use alongside that. And they think that's, again, coming back to that mechanism of why do we think it actually improves outcomes? They think that's one of the main drivers, is that we're stimulating natural killer cells. We're stimulating T cell counts and activity, which again are part of our primary anti-cancer defense network. And they think that's part of the reason why these improve outcomes as far as cancer survival. If you look, and I'll send some of this data over to Dr. Bressett to share as well, Coriolis or turkey tail extract, when we're talking about survival ratings, that is one of my mainstay therapies that I use quite often in my oncology practice. The best data that we've got so far is in 3 major types of cancer. Breast cancer, and that's estrogen receptor positive or negative, HER2 positive or negative breast cancer, and triple negative breast cancer, which is basically hormone agnostic. It doesn't respond to any hormone therapies. Gastric cancer is the second one that actually has very good levels of data on it for improving survival and protecting from white blood cell count drops during chemotherapy. And again, for people who work in oncology are aware, gastric cancer is a very aggressive type of cancer, poor survival ratings. Chemotherapy, it doesn't respond very well. It tends to recur even when we get rid of it. And it requires aggressive, sometimes surgical management to try and even give us a chance at long-term survival. Coriolis, in some of the trials, has shown almost a doubling in overall survival rating in 2 of the randomized control trials that it was used in conjunction with chemotherapy, standard of care agents. So very safe, did not interfere with the chemotherapy efficacy, and in fact improved survival ratings and outcomes significantly. Third area, when we're talking about levels of research on it, third area that has excellent research is colorectal cancer as well too. This was in stage 1, stage 2 colorectal cancer, surgically resectable or not, but also in stage 3 and metastatic colorectal cancer as well. Addition of Coriolis, again, reaching that 2, and some trials went all the way up to 6 grams per day. Very heavy doses of turkey tail. Again, watching for indigestion and some side effects digestive-wise with that, but getting to 2 to 6 grams, somewhere in between there, has shown significant survival advantages in colorectal. So again, if we're trying to be specific to the research trials, breast cancer, gastric cancer, colorectal cancer have the best data. I think, again, just based on my practice and seeing what I've seen Coriolis be effective in a lot of other cancers that maybe don't have these large trials. But when we start to see these mechanisms be reproduced in several different types of solid tumor cancers, we start to be able to experiment in our clinical trials and in our clinical practices, and take that out and say, if it's working that well in all these different solid tumor types, often it's worth trying to bring that in because it's shown safety, but trying to bring it into treating other solid tumor cancers as well.
Thanks, Dr. Best. I've got another one here that I'm going to have to read off. So let me know if you need me to repeat anything.
Yeah, sounds good.
So one of the big breast cancer trials is one out of Bastyr. It was phase 1 clinical trial where they used 6 grams of the myceliated grain. And what was shown is that some natural killer cells were increased. So given that, Namex and real mushrooms, their potency has guaranteed kind of active compounds, you've kind of touched on the dose here. So I hope whoever asked this questions can kind of go back and hear what Dr. Best was saying about dosing and kind of the mitigating the upping of the dose with the GI impacts. That kind of answers their first question. But another question was, do you think, and turkey tail we know has pretty safe and pretty solid clinical data on not interfering with any of the kind of liver clearance of the chemo drugs, but do you feel that reishi has any kind of interaction with that kind of CYP system in the liver? And what's your take on using that kind of throughout the actual treatments on the treatment days? Is there any kind of risk there with that liver clearance or that phase 1 kind of system?
Yeah, that's a good question, actually. So again, when we're using when we're using integrative and supportive care agents alongside the conventional programs that patients are using, one thing that you want to pay attention to is whenever your patient is coming in, any new medication, any new chemotherapy agent that they're using, pull up the monograph for it and check to see what enzyme systems are actually metabolizing that medication. So a good resource for a lot of people that are working in oncology, the BC Cancer Agency actually has some excellent professional monographs. If you take any chemotherapy agent, targeted therapy, immunotherapy, you name it, almost every drug, even very new drugs, are going to have a good monograph for this. Just type in the drug name and type in BC Cancer monograph. It'll give you a really good 3 to 4 page professional breakdown that will include several things on it. First thing will be the pharmacokinetics on it. So it's going to tell you what's the half-life of that drug, how is it metabolized, which enzyme systems does it interact with, is it primarily fecal elimination versus urinary elimination? So is it affecting the kidneys or the liver more, which is really important when we're talking about combining therapies. It also has a really good list on there of all the common and uncommon side effects that can show up with these medications. So you can actually take it and it gives percentage risk chances of each of these side effects showing up. So I'll screen that over with each new patient as they come in. And then you kind of know when you're pre-planning and then going through that supportive care planning for patients, you know which side effects are most common to show up for a patient, and you know which ones you're very likely going to have a supportive plan ready for to get ready with that. Second piece with that, again, they do a pretty good job. Now, this is mostly going to be interactions data with common other prescription medications, but they'll list that usually in a table at the bottom, showing which medications can actually be increased as far as their levels, which ones might be decreased because of the interaction with that chemotherapy or targeted therapy agent. But you can also take that information. Another really good database for people that are using a lot of supportive care agents for this is something called the Natural Medicines Database. You can look this up. If you're a naturopathic doctor on the call, if you're a member of the CAND, you actually have free access to this through your CAND portal. The Natural Medicines Database is by far the most comprehensive and research-based database that we have so far. You can actually type in any medication, chemotherapy agent, alongside any natural therapy, and it does a pretty good job of running an interaction checker for telling you which enzyme systems might be interacting there and what you might want to monitor for. Is it an absolute contraindication, very high risk to combine that? It'll tell you that. Do not combine these. Is it a relative contraindication? Could they have minor effects on each other? And what do you need to be monitoring for? Also going to be on there as well too. So that's a really good safety mechanism. And I'll do that with a lot of new drugs and new supportive care agents that I don't have a lot of familiarity with when I'm starting to introduce them with patients. With reishi, reishi is metabolized through several different enzyme systems, actually multiple enzyme systems in the liver. And that's important when combining it with liver enzyme, basically liver enzyme inducing or liver enzyme suppressing chemotherapy agents. So if you run that interaction checker and you see that it's running through a similar enzyme class there, what I usually recommend for those patients is, if there's good reason to think I should still be using this agent because I want to support a quality of life outcome, I want to reduce the risk of a side effect, or I want to try and improve their odds of actually getting rid of this cancer, improve their outcomes there, what I'll do is I'll initiate that therapy, but I'll make sure that they're coming in for, make sure they have a baseline screening of liver function and kidney function at that point. I'll also make sure after 2 to 3 weeks of utilizing that therapy, I'm rerunning those liver enzymes, rerunning AST and ALT, watching GGT, watching LDH for general liver inflammation and other types of inflammation that can show up with that. Same thing with running a basic GFR and creatinine to check for that kidney function. That way we can be safe. If we know that the only thing we changed at that point was that supportive care agent, the reishi mushroom extract, or another agent that we added in, and we see liver enzyme jumps, nothing else changed with their protocols, we know that it was very likely going to come from that agent, and then we can reduce the dose or cut that therapy out if we're concerned about that. I've seen reishi mushroom very, very rarely. I've seen thousands of patients, oncology patients at this point in my practice. I think I've seen very likely 2 cases where the addition of reishi and turkey tail caused liver enzyme elevations. That was also complicated with the fact that both of those patients were using helix or mistletoe extracts, which can also potentially cause, very rarely, liver enzyme increases as well. We took both of those patients off of all of those extracts, and those liver enzymes came down. So I have seen it. There's very small clinical evidence that suggests it can happen as well. Just something to pay attention for. Rare, but could happen if it's interacting with a liver inflaming or liver interacting chemotherapy.
Thanks, Dr. Best. And to follow up with this practitioner's question is, so if there was an interaction, is there kind of like a washout period sometimes where you kind of just like wait a couple days to let that chemo really do its thing, or maybe it's radiation, but maybe in this example, maybe it's more of the chemo style. Do you kind of let like a washout period before getting back into the reishi if you think that it is impacting the metabolism?
Yeah, for sure. So if we do see those liver enzyme jumps and you're suspicious that, again, it wasn't a change with anything else, it was reishi mushroom or Coriolis being added in there, reishi having more concern with it, I would say wash it out for at least a week to 2 weeks. What you want to make sure is, number one, we need to see liver enzymes coming back down on that rerunning of the blood work. Number two is, again, watching for signs of liver inflammation itself, right? Patients will come in with certain specific symptoms, especially if that liver irritation and inflammation is very strong, if it's actually causing significant issues. Watch for, obviously, jaundice and icterus in the eyes, so yellowing of the eyes, yellowing of the skin. Some patients will actually get itchiness. That's very common to see that when you start to see liver or gallbladder compromise or inflammation. And that can happen with chemo and with some of these other agents as well. So pay attention for that. Also, darkening of the urine. That's something to pay attention for. That hemoglobin breakdown can become compromised when the liver is struggling. And you'll actually see urobilinogen, a breakdown product of hemoglobin, actually starting to show up in the urine. And they call it Coke colored urine. It's darker color, not blood, but a darker kind of brown color almost to it. Those are usually more advanced signs of liver compromise. The first signs you're going to see are not symptoms, but you're going to see those liver enzymes start to double or even triple. Something also to be aware of when you're tracking liver enzymes in cancer patients, it's not actually considered pathological to see an AST or an ALT even double in patients. That's not actually a major concern. That's not associated with negative health outcomes. And some chemotherapy agents will just cause those, what we call transient liver enzyme increases. Still be aware of that. That's something that you might want to deal with if those liver enzymes don't actually come down once they finish chemotherapy. That's something, as an integrative specialist, we can come in and start to do our liver support mechanisms after those therapies are completed to make sure we're supporting and reducing liver inflammation and getting the liver detoxification pathways really optimized. But mild increases, not a concern. Tripling or quadrupling of those AST and ALT numbers, that's where we're starting to get concerned. That's where we want to pay attention to what therapies have changed in that time where those things jumped up. And that's where we might actually want to start to take action, dropping therapies out or giving that 1 to 2 week washout period as well.
Thanks, Dr. Best. Take a little bit of a break here just because you've been doing really good and just giving us all the info. So we'll take a couple deep breaths, everybody. Give Ryan a break here. And I know that Lee's got a good question next. So if everybody wants to get a drink, give Ryan a little bit of a break here. And whenever you're ready, Dr. Best, we'll kind of get back into it. But
I know everybody's pretty busy. So if you want to keep going, I'll try to maximize their time. And I showed up late, so we're going to try and keep the information rolling.
Yeah. And you let me know when your time has kind of come to an end, because I want to respect that. Lee's question is, he wants to know your experience, Dr. Best, with using full spectrum fruiting body extracts like real mushrooms, like Namex, versus purified beta glucans. If you have any research with that, whether that be, I think Lee might be referring to, like Ganopoly or something that's more of like an isolated beta glucan, PSK, PSP, nobody's got access to that, but I don't know if you have any talking points on the isolated, the purified beta glucans.
Yeah, really good question. And I'll kind of tell you, at least from what I've seen in the clinical evidence, what we know and what we don't know so far, and where the ongoing research is going. So the isolated beta-D glucans, we know that the beta-D glucans as a group, do seem to carry some of the immunostimulatory properties of medicinal mushrooms. We know that beta-D-glucans, when used on their own in proper doses, can have immunostimulating effects and do seem to be able to increase white blood cell counts. That was shown in some animal trials. It's been shown to be protective and potentially helpful for prevention of certain types of illness, especially viral illnesses, they think because of the lymphocyte increases. The problem with that is, if you look at some of the other data, what we figured out over time is that we don't fully know which of the extracts that are found in these medicinal mushrooms are actually responsible for a lot of these immunomodulatory effects. Some of the beta-D-glucan research did not stimulate the white blood cell increases to the same level as some of the whole mushroom plant or extracts that we're using in clinical practice, and some of the ones that Namex is using as well. Why we think that is, again, we don't fully understand how all of these different medicinal compounds that are found in these mushrooms are interacting and interplaying with the human physiology. This happens a lot in medicine as well, too, and we all know this as well. A lot of our medications, prescription medications, are actually isolated compounds that we originally find in fungi, in molds, in bacteria, in different plant extracts. And then what will happen is, because you can't patent a whole plant extract, they'll try to isolate individual molecules that are found in those. They'll isolate them, they'll concentrate them, and then they try to turn them into a medication. And sometimes that can have beneficial effects. Lots of medications, I use lots of medications in my practice as well. They can be very helpful in certain situations. But the problem with this, coming back to medicinal mushroom extracts, is I'm not convinced that beta-D-glucans by themselves are going to reproduce the same immunomodulatory protective effects that we see in oncology care. I'm not convinced, and we have no evidence to suggest that isolated beta-D-glucan extracts are going to provide the improved outcomes data as far as cancer survival in all these different solid tumor types that we've seen with whole plant extracts, using whole fruiting body extracts with medicinal mushrooms in oncology care. Now, there are some exceptions to that. One that was interesting, Dr. Bressett brought up there, is something called polysaccharide K, PSK for short. Polysaccharide K is thought to be one of the more active medicinal compounds that's found in Coriolis in very high levels, in turkey tail mushroom. In Japan and South Korea, they actually isolate polysaccharide K, and they will use this in the hospital for certain types of cancer, primarily breast cancer. This is given orally, but it's actually been isolated as an injection therapy as well. We don't have access to that in North America. Believe me, I've tried to kind of smuggle that into Canada through various means, and I cannot get a hold of it. But polysaccharide K does seem to have, it already has some clinical trials on it, that it's proven itself as a useful solo therapy. And it does seem to have some fatigue protective effects, and it does seem to improve outcomes in certain cancer subsets of patients. But again, what does the totality of evidence so far suggest to us? The totality of evidence, when we're looking at fatality rate, 5-year survival averages around 10 to 15%. So pancreatic cancer is one of those cases where I tell most other integrative practitioners that I work with or that I coach, is that you want to be aggressive off the bat. You want to hit it from multiple angles. You don't want to give it time to metastasize and grow. I always tell my patients, when we're going to act on it, let's hit it multi-pronged and let's hit it right away, okay? When we're looking at supportive care with medicinal mushroom extracts, pancreatic cancer, there is some research using 2 types of medicinal mushroom extracts. Reishi, again, has some data on it. The standard of care chemotherapy agents that are typically used with pancreatic cancer are going to be one called gemcitabine, the other one being what's called Folfox, which is 5-fluorouracil along with oxaliplatin, another a platinum-based chemotherapy agent. Reishi mushroom can be an excellent adjunctive agent to reduce the side effects with that, and does seem to improve survival ratings. This is high dose, 4 grams, using 2 grams twice a day, improved the response rates, slightly improved overall survival ratings in combination with those chemotherapy agents in pancreatic cancer. Couple of other agents, things to be aware of in pancreatic cancer. High dose curcumin extract, again, not a medicinal mushroom extract. High doses of curcumin. I use Mariva curcumin in practice because most of the clinical data has been actually done in the oncology world with Mariva specifically, which is a liposomal form of curcumin. High doses of Mariva, 1,000 milligrams twice a day, significantly improved survival ratings in almost every pancreatic cancer trial that it's been done with. And this is about 5 randomized control trials now. Significantly reduced cachexia, which is cancer-related weight loss. I've also seen cachexia kill pancreatic cancer patients before the cancer did. The weight loss can be massive with pancreatic cancer, and cachexia is a serious problem with quality of life. High dose omega-3 fatty acids and high dose curcumin, a gram twice a day with food, can be a very significant survival improvement and can also improve quality of life, reduce fatigue, reduce pain, as well as improve cachexia ratings in those pancreatic cancer patients as well. Third piece as well, if you have access to either in your own care or in you have access to a referral center that you can get access to, high doses of intravenous vitamin C, 50 to 75 grams per intravenous solution. 3 to 4 very large clinical trials at this point, used alongside or by itself in pancreatic cancer or alongside gemcitabine or FOLFOX, showed significant improvements in survival ratings and improved fatigue and pain scores when used alongside those conventional agents or even when used on its own. This is something that, again, the major cancer center in my area in Calgary called Tom Baker Cancer Center, I've got 2 or 3 medical oncologists now who will actually send patients down to see me to get those intravenous therapies done because they've seen so many of their patients do well with it, and the data has been so decently robust. And again, a lot of times with these aggressive cancers, we have to think a little bit more outside the box and we have to be a little bit more aggressive with that. Survival ratings already aren't good in that. We want to take that combination approach. But again, turkey tail can be useful. Reishi, I think, plays the major role when it comes to this. And the other medicinal mushroom extract that I'll actually use quite a bit of in pancreatic cancer as well as colorectal cancer, especially along with chemotherapy, is actually something called AHCC. Activated hexokinase correlated complex MACE. Am I saying that right? I'm not really 100% sure on that.
Something like that.
Yeah, AHCC is basically, it's actually extracted out of shiitake and maitake. But this seems to have chemoprotective effects. It seems to reduce the rates of chemotherapy resistance in several of the trials that it's been used in solid cancers. I'll often use a combination of AHCC along with Ganoderma, along with curcumin extract, like I mentioned before, also taking a look at using higher doses of omega-3s for the cachexia component, and then using intravenous therapies, high dose intravenous vitamin C, along with potentially helix or mistletoe extracts for quality of life management as well. That's kind of, again, a little bit of a side note, but hopefully that's kind of helpful in some areas to take a look at as far as your supportive and integrative oncology approach for pancreatic cancer patients.
Thanks. I think we're getting through a lot of them, so this is good. There's only a few left, and then we'll see kind of if we can wrap it up within an hour and 10 minutes here. One question which I don't quite understand, but Marlene, feel free to unmute yourself. Marlene does a lot of low-level therapy, both IV and topically. She's wondering, has anyone looked at mushrooms for their phytoactive properties? So I'm not quite sure about that, but you might have more info.
Yeah. So Marlene, correct me if I'm wrong on this. If you're speaking about photobiomodulation or photodynamic therapy.
Low-level light therapy, all the same.
Yeah, exactly. So low-level light therapy or low-level laser therapy, it has like 50 names in medicine just to make things more confusing, is basically typically using red and infrared light to try and induce some types of physiological changes in the tissue it's being applied to. So from the supportive care side, low-level laser therapy, we actually use quite a bit of it in my oncology practice. It can be a very good supportive agent for oncology care. We use, again, I'm not promoting any specific products. I use a BioFlex device in my practice, but BioFlex, Theralase, and another company called Thor actually make very good quality class 3B medical lasers. These are high intensity red and infrared light that have several different physiological effects on the body. I can send papers if anybody's interested. I'm sure Marlene could probably share some of those as well too. But you can take a look at some of the papers on the mechanisms, but where I actually think it's been useful and where we've got really good clinical trials on in the oncology world specifically is in a couple different cases. Number one is chemotherapy-induced peripheral neuropathy. For people that aren't aware of that, this is chemotherapy-induced nerve damage, and this can be a severe side effect for a lot of patients going through conventional care. A lot of chemotherapies, specifically the taxane group of chemotherapies, as well as platinum agent chemotherapies, carry very high risks of nerve damage that tends to show up in the hands and the feet. This starts mild. It will start as tingling or numbness, lack of sensation, but it can progress all the way down to the palms of the hand, take over both hands, both feet, and can get to the point where patients can no longer grasp objects. They can no longer walk because their balance and coordination has been completely negated. This is a reason that a lot of patients end up having to stop chemotherapy as well, because if it progresses to grade 3 or grade 4, it can become permanent, and that's a major issue. So laser therapy, low-level laser therapy, is one of the best treatments that we have for prevention and treatment of chemotherapy-induced peripheral neuropathy. It's very nerve regenerative. When it's applied directly over the hands and feet, we'll often use this prophylactically for patients, having them come in once or twice a week when they're going through rounds of these chemotherapy agents that are highly neurotoxic. And I've seen it significantly reduce and sometimes completely prevent neuropathy from developing in these patients. The data on it is also really good. We've got several randomized control trials with several different agents showing really good outcomes in not only preventing it, but also treating it if it starts to show up. So low-level laser therapy, I think, is something really useful that you can bring into your clinical practice if you're seeing a lot of these oncology patients who are using chemo. Second area that we use quite a bit of it is in something called lymphedema. This is lymphatic swelling that's induced typically in two major areas for patients. Breast cancer is the main use case for this. Most patients who have breast cancer are going to be considered for surgical removal. If it's stage 1, stage 2, it's still localized in the breast, or it's come into the axillary lymph nodes, those regional lymph nodes that are found in the armpit and that surrounding area. That's where breast cancer likes to spread first. A lot of stage 1, stage 2 breast cancer patients, the primary treatment is going to be removal, either a lumpectomy or a mastectomy, removing the lump or actually taking the breast off as well too. Secondary piece will be what's called a lymph node dissection. They'll very likely take several of those lymph nodes out if they suspect that there's cancer in them. One of the big quality of life issues that comes after that is localized, what's called dependent lymphedema, significant lymphatic backup inside the arm, the dependent area where we had that lymphatic drainage issue. That can cause pain, that can cause severe swelling inside the area, and it's a big quality of life issue for your breast cancer patients. Using low-level laser therapy directly over top of that lymphatic area, the lymph nodes in the axillary area, has excellent evidence on it, and I've seen it drastically reduce lymphedema-related swelling and pain. I'll usually combine that, so we'll typically run patients through several rounds over 4 to 6 weeks of low-level laser therapy. I've seen anywhere from 30% to 100% elimination of pain scores and significant reductions in the lymphatic swelling, as well as significant improvements in continued lymphatic flow after that. Again, if the lymphatic tissue has been completely compromised, you've had complete removal of all of those lymph nodes, and there is no more lymphatic vessels to drain, you're not going to be able to cure that. But you can still often reduce the pain and swelling that those patients are experiencing, and I'll often combine that with lymphatic massage. I refer to a lymphatic massage specialist in my area who works with those patients as well to try and improve that drainage. So in patients that don't have full compromise, you can have significant improvements in that. Patients that have full compromise of that flow, you can still offer quality of life improvements. And laser therapy can be a really effective addition with that as well too. Third main area that I'll use the low-level laser therapy or photobiomodulation would be in mucositis, actually inside the mouth. This is a really common irritation that happens with a lot of chemotherapies or with radiation to the head and neck, causes severe mouth sores, oral irritation and swelling, a lot of pain and difficulty swallowing foods and liquids. Very big quality of life issue. Two mainstays in my practice for that: oral glutamine, swishing and swallowing it. Swishing it for 30 seconds is actually a very good treatment, and then swallowing it to treat the actual esophageal tissue as well as the lower parts of the GI system can be really beneficial in treating and preventing some of that GI irritation, including the mucositis. We can also take the low-level laser therapy device that I have, actually has an oral applicator. You wrap it in basically a cellophane wrap, and the patient actually, we put it inside the oral cavity, they bite down on it, and my laser technicians will actually apply it to different areas of the inside of the oral membrane. It has excellent research on it for reducing and completely negating sometimes those oral mouth sores that can show up in the oral irritation. Can be a really effective add-in in your practice. That's a bit of a side note for Marlene's question. The bottom line was, can we photosensitize potentially using medicinal mushroom extracts with low-level laser therapy? I haven't seen in my research, Marlene, this is not to say it's not real, but I haven't seen in my research outcomings that the medicinal mushroom extracts can cause photosensitization effects with low-level laser therapy. But what's interesting is there are some drugs and there are some photosensitizing agents, one of them being niacin with UV light specifically, and with blue light, along with curcumin, actually. Curcumin extract seems to be very strongly sensitized by the blue spectrum of light. We actually have a laser device in our clinic that can use very high intensity blue light. We'll have patients take very bioavailable oral curcumin or actually use it intravenously in our practice, allow it to infuse after 30 to 60 minutes, and then we apply very high intensity blue light directly over top of tumors. That can actually have some photosensitizing effects, create reactive oxygen species inside those tumors. And a lot of my colleagues in Germany are actually using this as a mainstay in their practice right now and pumping out some really good small scale studies on getting better cancer outcomes in patients that are no longer, because they've failed multiple chemotherapy rounds or radiation, they no longer have conventional therapies that are of use to them. They go into these trials and they're showing some pretty good outcomes with using what we call photodynamic therapy, combining light with photosensitizing drugs and therapies. So hopefully that's useful. And again, I can share some cool data on that if you'd like more research on that, what we're doing in practice.
Yeah, so what I'm doing is we're using different combinations of curcumin, ICG, vitamin C, chlorophyll, and we're giving them intravenously. And then doing endo laser. So I have a Weber lasers. We're using everything from the ultraviolet spectrum all the way up into the infrared spectrum. But the yellow, the green, the blue, they all have different peaks on, and I use poly-MVA as well, which peaks at all the different colors. So we're doing that, and we're looking at a study right now using a special chlorophyll that this company has made, which has been tweaked a little bit to be a little more bioactive, and it can be given orally. And then after you give it orally, you can use the different colors of light, either in the oral cavity or rectally, or to photoactivate it. So I was, I'm looking at all these compounds and thinking about mushrooms, and I don't see why it wouldn't be photoactivated.
Yeah, and so we use the same system in our practice, the endo laser system as well. The interesting thing with a lot of the medicinal compounds that we're using, a lot of our supportive or integrative therapies, if you actually look at spectrum analysis studies and you look at where they tend to be photosensitized, the vast majority of them are actually photosensitized in the blue and the UV spectrum. That's true for a lot of things like artemisinin and artesunate. It's true for intravenous vitamin C. It's true for a lot of our actual oncologic therapies, including actually certain chemotherapies can actually be photosensitized in that spectrum. I would have to look, and it would be interesting to actually take a look, because I wonder if there's actually some studies that are looking at the photosensitization of the actual individual molecules that are found in the bloodstream. If you come across any of that, I would actually be really curious to see that as well too. But I would imagine that I bet you there are a couple of compounds that come through the medicinal mushroom extracts that would be photosensitized in that blue or ultraviolet spectrum.
All right, I'll make that my project.
Yeah, that'd be great. I'd love to hear a little bit more about what you guys are doing in your practice as well.
I'll contact you individually.
That'd be great.
Okay, how are you doing for time, Dr. Best? You got 10 more minutes?
I still got about 10 or 15 minutes, yeah.
Okay. Has anybody got a question they want to ask? If not, I'm just going to skip through the chat box here and keep going down the line. But if anybody has wants to unmute themselves and ask Dr. Best a direct question, now would be the time.
I saw one interesting question actually in the chat box as well too. Two questions actually. One really good patient compliant question. Reishi is super bitter. How do you get your patients to take 1 gram orally? very good note. Anybody who's taken high doses of reishi or even tried reishi powder, it's potent. It's really, really bitter. Two things that we'll actually do in practice. Number one is I have it actually compounded with a sugar-free. So we actually get Namex powders compounded through a company called Signature Supplements, and they actually add a chocolate flavoring agent to it. This is it's a non-caloric sweetener that goes into that, but the chocolate flavor, I've actually surveyed a lot of my patients on this, and I've had a lot of patients who hated our old extracts. When I switched it over to the chocolate flavored extract, they noticed that it seemed to mask it, and it did it quite well. So make sure you've got it with some very potent food extract. A lot of my other patients will actually take those powders and they'll put them in a smoothie every day. So they'll take, and this is a good way to get a lot of our other types of therapies in there. You're trying to get your patients to consume more greens. You're trying to get your patients to consume more of these phytoactive fruits and vegetables. Smoothies can be a good delivery mechanism for that. You can flavor it with other agents to actually make it palatable. I've had a lot of my patients actually be able to put significant doses of the medicinal mushroom powders in there and completely mask it. Chocolate's the best thing I found for masking it. I've had some other patients swear by using bananas, consuming something with banana, pureeing it, and mixing the powder in there with a little bit of cocoa powder. A lot of my patients have noticed that it really seems to improve compliance. So try that out. It takes a bit of trial and error, but that's the best stuff I've seen in practice so far. But if you're using things like Signature Supplements, they'll actually take those Namex powders and compound it with several different flavoring agents as well too. And you can still get that high dose without having to have patients come in and tell you that they don't want to touch any of your supplements ever again. Another good question there as well too. So response to solid tumors, but what about blood-borne cancers? This is another really interesting field when we're talking about relative contraindications. A lot of our leukemias and lymphomas, these are white blood cell based cancers. You're looking at cancers where you actually have certain subsets of either B cells, T cells, or in very rare cases, natural killer cells are becoming hyper aggressive, drastically increasing in number, and those are actually the cancer cells that we're trying to treat. So that's an area where, again, we don't have a lot of good clinical data with using medicinal mushroom extracts in those blood-borne cancers. Dr. Bressett, can you comment on that? Have you seen anything recently about blood-borne cancers, medicinal mushroom extracts at all?
No, I was doing a deep dive on CLL and I didn't find much. So I kind of just have been a little bit more conservative, but yeah, same thing, just kind of watching and waiting.
Yeah, there's again, these are theoretical mechanisms. We don't have yay or nay answers on this with trials. We don't have trials that prove that they're dangerous, that they can actually make the cancer more aggressive, because again, being immunostimulatory, that's a concern. We don't have trials that show they're effective, and we don't have trials that they're neutral. So again, I would say play with caution with that. If you don't have a very good reason for utilizing those medicinal mushroom extracts or really any very potent immunostimulatory therapies, be very cautious in blood-borne cancers, white blood cell-based cancers. My recommendations with that, I don't tend to use medicinal mushroom extracts in leukemias and lymphomas. We have better research therapies for that actually have good data on them to show safety and efficacy. Two trials are two general therapy, supportive therapy, something you should be paying attention to for your leukemia and lymphoma patients. High doses of curcumin extract, again, very toxic to a lot of different types of leukemia and lymphoma cells. Same thing with high dose EGCG extracts, high dose green tea extracts. Very good clinical data, multiple phase 2 trials, using it in combination with several different conventional targeted therapies or on their own, showing significant reductions in white blood cell counts, significant reductions in some of these CLL cell counts, as well as in some of the lymphoma cases as well too. We've seen some good metrics with that, and I've seen good responses in patients. Third area, something to pay attention to, is if you have access to helixer extracts, mistletoe extracts, can be very useful in blood-borne cancers as well. And there are certain intravenous therapies that can also be helpful for knocking down those counts, along with a lot of the other supportive care agents that we're going to use based on which conventional therapies they're using. If they're using things like rituximab or some of the anti-CD20 therapies, watching for, again, immunosuppression, that might be one of the rare use cases where you're using rituximab, you see massive drops in their white blood cell counts, you may want to counteract that with low doses of some of the medicinal mushroom extracts, but make sure they're getting follow-up blood work to make sure we're not seeing any rises in the actual leukemia and lymphoma cells themselves. So pay attention to that. Again, err on the side of caution, err on the side of not really, unless there's very good reasons to go down that route. Hopefully we'll see some more data that can help guide us a little bit further in the future.
Thanks, Dr. Best. Hopefully that helps you out there, Rob. Great question. One that I was always pondering as well. I have a question. So, we hear that mushrooms are immunomodulators, and, in some of the studies that they actually track like cytokines and interleukins, we can see that there's like an up or a down, and we can kind of see that impact. I guess first question is there mushrooms that are have more of an immunomodulating effect in the integrative cancer world or your other work? And then do you ever use cordyceps? Because I know there's some, I think it's Asian data on maybe some liver cancers. And I did see one, it's not a full spectrum extract, but it's more of a derivative. It's a thyroid study actually that I think has the best immunomodulatory research behind it. What's your take on immunomodulation, and do you ever use cordyceps?
Yeah, good question. And cordyceps is something we haven't really talked about. From the oncology side, what I can tell you is that cordyceps has some smaller trials in prostate cancer, actually, which is interesting. It seemed to improve quality of life outcomes in combination when people were getting external beam radiation therapy to the prostate, which is radiation is a very common treatment for what kind of Gleason score 7, 8 prostate cancer that's starting to behave more aggressively, and we think we need to medically manage it. Radiation is very commonly used there instead of doing a total prostatectomy. And I think cordyceps actually seems to provide some better outcomes, better outcomes as far as longer term keeping that cancer in check and not seeing cancer spread, extracapsular spread of that prostate cancer. And it seemed to improve fatigue scores in a lot of those patients who had prostate cancer, which is kind of cool. I agree with Dr. Bressett in that case. I think cordyceps actually seems to have some very potent immunostimulatory properties. And this is again, my patient preference and just kind of my practice style. I'll actually use cordyceps a lot, not for my cancer patients. I use cordyceps a lot in my general patient population. I use it a lot in my men's health patients. I'll use it for people that are struggling with daytime fatigue, that are struggling with just chronic viral infections because of that immunostimulatory piece. I don't know if Dr. Bressett can comment on that as well, but I think I've seen some better outcomes with using higher doses of cordyceps extracts in supporting immune function, reducing that risk of infection in chronic infection patients, and just seeing better energy scores as well.
Yeah, totally. Big use in my clinic as well.
Yeah,
totally, with those viruses and pneumonia even.
Yeah, there's some bigger trials that are actually ongoing right now. Again, a lot of the cordyceps research is actually coming out of Taiwan, Japan, and a lot of Chinese medical centers as well too. But there's some pretty big trials that are ongoing, should be published in the next year or two, and hopefully have some more data, kind of not just mechanistically what cordyceps is doing, but use cases. We do think it actually has some, along with reishi mushroom, some very potent antiviral activity as well. And reishi, a lot of people aren't aware of that. Reishi actually has some very good data on it for antiviral activity. Epstein-Barr virus, cytomegalovirus, we've got some good trials there as well too. And there's potentially some hepatitis research coming on that for various hepatitis viruses as well. So another thing to pay attention to, potentially through lymphocyte stimulation, we don't exactly know, or is it directly antiviral against stimulating some damage to those viral particles? We're not sure, but it does seem to decrease viral load in a lot of these trials. So interesting as well.
Yeah, that's unique, especially because that could kind of fall in the preventative role too, right? In the cancer prevention world with some of these viral precursors.
Yeah, really interesting data. This kind of touches on the autoimmune disease world as well, but we're seeing a lot of information coming about chronic low-grade viral infections Epstein-Barr virus, cytomegalovirus, certain types of herpes simplex virus, other types in that family of viruses, again, being good at hiding and staying dormant. We don't have great medications to knock those out completely, but if they stay dormant in the system, not always causative, but significantly increasing the risk of developing things like MS, developing things like Guillain-Barré syndrome, very severe nerve disorders, significant increased risk of developing certain types of liver cancer, certain types of actual brain cancers as well too, and other neurological and autoimmune diseases. So something in the integrative world we always try to pay attention to in our patients is, what are the predisposing factors to maybe, why did my patient already develop this condition? But if they haven't developed this condition, maybe looking at screening for that, and how can we prevent the development of some of these very serious disorders in later years in life, and try to mitigate those and nip them in the bud before they become a problem. Antiviral is something that is definitely worth warranting further investigation, paying attention to.
Great. And yeah, you kind of answered Sandra's question, which was one of our last ones about Guillain-Barré syndrome and, which mushroom. So I think I'll just, and maybe just correct me if I'm wrong, but Dr. Best would probably recommend the reishi and the cordyceps due to their high antiviral capacities. If that is the predisposition to it. I know there's probably more going on there.
Guillain-Barré syndrome, very tricky syndrome. Again, can be very, very serious, can be permanent damage for some patients, typically spurred on by viral infections. What you want to be doing for those patients, again, is immune support, primarily antiviral support, and inflammatory support. You want to be really honing in on anti-inflammatory modulation there, and then really trying to hammer in the antiviral support with those patients. A lot of these patients, if it's severe, you're not going to be seeing them anyways. They're going to be inpatient. They're going to be hospitalized for this. But outpatient, if they're coming out less severe cases or they're recovering from it, focus on the inflammatory piece, focus on nerve regeneration. Again, looking at, and this is actually a case where I'll bring in things like lion's mane mushroom because of the hericenones, that nerve growth factor stimulation. Using higher doses of lion's mane mushroom extract has some pretty good data on stimulating nerve recovery. And we'll also include that in a lot of our formulations that we'll use for lots of different types of nerve damage and neurodegenerative conditions, including Alzheimer's and Parkinson's. Some of the best data we actually have in lion's mane is actually in Alzheimer's disease. There was a pretty decently.
Excellent, excellent, excellent. Well, we really appreciate you showing up, Dr. Best, and kind of sharing your really in-depth information and wisdom within the integrative cancer world. Want to be mindful of your time and everybody else's time. And I think it's about time to kind of just transition here. So I appreciate everybody showing up, and thank you so much for attending the Real Mushrooms Roundtable. Next month, we're going to have a vet-focused one, which Dr. Rob will be joining me, and we'll be talking more about medicinal mushrooms and all their medicinal properties. So yeah, thank you so much. And again, Dr. Best, thank you so much for being here. And that was an amazing just unloading of high quality educational material here. So I think everybody feels that, and we're very, very grateful.
Great. Thanks for having me, Dr. Bressett. So yeah, like I said, I'll share some of that research. I'm sure they can get in touch with you, Dr. Mace there.
Yeah,
if we want to get that.
Yeah, you can. I'll touch base with you, and we'll send a recording out to this to those who couldn't make it, and we'll attach all the notes to the studies and the BC Cancer monographs and everything you mentioned. We can put them in the show notes for this.
Sounds great. Yeah. And I'll also put, if anybody's got any specific oncology questions, or they're looking to have someone in the local Alberta area to get some more support, I'll put my contact information in that email as well too, so that you can know how to get a hold of me from there as well. But it was a pleasure. I hope that was really useful for everyone. And then I look forward to being part of this again in the future. Thanks again for having me, Dr. Bressett.
You're very welcome. Thanks, everybody. We'll see you next time.